Okay, so I did the mental health of elite athletes. And what is mental health? Mental health is the one's optimal physiological and emotional health. And I chose this topic just because I've been around athletics for a while now. I've been playing softball since I was 9, so I've kind of grown up around the athletics world and I've seen everything. But since coming to college, I've kind of noticed like a big difference in mental health and how important it is. Um, the four most common mental disorder in athletes are anxiety, depression, drug abuse, and disordered eating. And the main reason for these mental disorders is because of a common disassociation between elite level athletes and their mental health. So, depression. What is depression? Depression is a state of persistent sadness, and it is the most likely mental disorder amongst elite athletes. And in one of the reports I read, there was a 20% increase of depression in athletes from post injury. So after they were coming back from mostly concussions, there was a 20% increase in their depressive symptoms. And for the treatment of depression, if it's detected early, the severity of the depression can be lessened and it can be treated. So this is a comparison of men and women in a variety of sports that have showed a prevalence of depressive symptoms. So there's track and field, soccer, softball, baseball, and lacrosse. And as you can see, there's like a 10 to 15% increase for the women athletes compared to the male athletes. Anxiety. So what is anxiety? Anxiety is defined as a state of intense worrying, and symptoms of anxiety in athletes can include, like I said, worrying, a high heart rate, feelings of incompetence, and athletes experience anxiety because of the pressure to perform well. There was one of the studies that I read showed that 43% of all collegiate female athletes have been diagnosed with clinical anxiety, and about 23% of the male collegiate athletes have been diagnosed with clinical anxiety. And then on the right, we have comparing athletes and non-athletes diagnosed with anxiety post-pandemic. So as you can see, the age groups where an athlete would lie under, so like 18 to 20, 21 to 30, maybe 31 to 40, but for the athletes, all of those counts are a lot higher compared to the non-athletes. So disordered eating. Disordered eating is associated with very high mortality rates. The number one reason for developing an eating disorder is because of body dysmorphia, which is where you have like a preconceived image of your body and it's not what it actually looks like. So it's a lot more common in women than it is in men to have an eating disorder. Sport-specific risk factors of eating disorder include like starting your sports training from a very young age. I think a lot that has to do with disordered eating in athletes is because the athletes just think that they have to like fit a certain role or look a certain way and fit this like stereotypical athletic look, which is why I think a lot of the times it kind of resorts to developing an eating disorder. And these can also be treated. The earlier it's detected, then the better it is, the more you can lessen the severity of it as well. Drug abuse. So why do athletes abuse drugs? So the number one reason that I found that athletes kind of abuse drugs is because they want to enhance their performance. Drug abuse is most commonly found amongst collegiate male athletes and professional athletes. It was found that 2 to 5% of collegiate athletes have been caught using steroids before. And the most common cause of drug abuse is because of untreated mental illnesses. So I think if, like I said in the past slides, like for anxiety and depression, disordered eating, like the earlier you catch these disorders, the better it is, because then it can lead to drug abuse and other things. So the role of coaches and trainers, I think it needs to be a priority amongst coaches and trainers to prioritize their athletes' mental health. I think a lot of times mental health has just kind of been like put past athletes, and it hasn't really been a pure focus. So to the right, I included like what coaches can look for in their athletes. So just kind of says like check in with your athletes on a regular basis. Make sure to ask your athletes what they are thinking, how they are feeling. Benefits of early detection, I think coaches can have a big part in this. I think they can kind of realize like when their athletes are changing, like what's going on. They definitely notice like a change in their athletes. So I think they can play a big role of detecting it early on. And I think educating themselves about these disorders can also play a big role. I think the more educated they are, the more likely they are to realize when these mental disorders are prevalent in one of their athletes. So the importance of mental health in athletes is a lot more important than how athletes perform on the field. If an athlete's mentally healthy, they're going to perform better anyways. So I think mental health really needs to be prioritized amongst athletes, because like I said, it's kind of just been, I feel like it's just kind of been brushed by athletes because we're obviously like known to be strong, like, and I think a lot of times it's just not a very common thing to think about how mentally ill some athletes can be. I think if athletes seek help, they can help themselves a lot more than anything else would. Them seeking help and like wanting to do better could also go a long way for them. So I just think if like mental health in athletes becomes like a top priority, then a lot of things could change within within athletes in general.